Hi, my name's Naeem Khan. I'm an acute medical consultant and a geriatrician in East Surrey Hospital. I've been a consultant for about 10 years. Um, I do sort of a mixture of elderly care, acute medicine, and I'm also a college tutor, which is just a post I got recently. So I'm going to start maybe the other way around. I'm going to start where Dr. Hussain left off. I'm going to talk about what I would tell my younger self. So I'm imagining myself sort of at the age of maybe 14, 15, when I'm just doing the GCSEs. We're not sure what I want to do afterwards. Um, uh, Something that I borrowed from a good sales talk I once listened to, and it said, people don't buy what you do, and they really don't care about how you do it. But what they do buy is why you do it. And if you can connect to someone on why you do what you do, then the rest all falls into place. So I'm going to start with why I do, and I'll work through how I did it and what it is exactly that I do. Fine, okay. Yeah. So I'm going to say, don't go into medicine if your only reason is to help other people. There's plenty of careers where you can do that that won't give you as much, headaches. From being a nurse to being a teacher to being a pilot. There's lots of things you can do to help other people. It doesn't have to be medicine. If you want to do medicine, be selfish. Think about what gives you energy, gives you positivity, because it's such a demanding career that unless you get a buzz and a lift from what you do, you will burn out. And a lot of people do in medicine, unfortunately. So what do I mean by gives you positive energy? Um, I put a few things out there. It's not an exhaustive list, but the kind of qualities that I think if you enjoy, you will probably be okay in medicine and do well and enjoy your job. Do you like putting others first? Would you be happy giving your last slice of pizza to your best friend? And if you did, would that make you feel a bit annoyed and put off, or would that make you very proud and happy and something you would talk about to your mum when you got home? Um, do you like building relationships? Do you like going to a place somewhere where you don't know and you can approach someone and and sort of think of something you have in common? What would you do to try and maybe start a dialogue and then maybe even keep that going so that next time you meet them you can talk to them more freely? Do you like juggling multiple tasks? If you've got an exam, do you find that you can't do anything else? Do you find that actually when you have an exam you like to balance it with the football game, but also maybe get a bit of PlayStation in? If you like doing lots of things at once without that taking energy away from you and feeling a bit washed out from that, that's probably a good quality to have as a doctor, because you will be doing a lot of things all at the same time. And keeping those balls in the air is really useful task. Do you like using your hands? From in my line of work, I might be examining patients to try and find out, examining their tummy to find out what might be wrong with them, to what Dr. Khan said about, operating on something as little as the back of someone's eye, and the fine, delicate things you might have to do. And when you do that, do you find that you get a bit of a buzz from it? One of the things that you end up doing a lot in medicine is taking responsibility for others. So, your younger brother falls over and cuts his knee, and your mum tells you off. Now, you didn't push him over, or at least I hope not, but you might have to take the telling off for it. And if you did, do you feel annoyed about it, or do you feel maybe a little sense of pride that you were able to shoulder that? And if you can do that, that's probably a good quality to have. Now, at the age of 14, did I have all of those? Probably not. But did I want to have those? I think I did. It's very difficult to kind of demonstrate that at that young age. But have a think about what you can do, from whether it's doing charity work, or even maybe starting something at school, starting that dialogue with your parents, starting that dialogue with your teachers. What can I do that maybe would test some of these things? And when I test them, just be honest with yourself. Does that give you that positive energy? The Don't think about what's good about medicine and what's not. The qualities of medicine aren't what makes it great. It's what you bring to it. You'll meet the really good people in your training, and the best thing about medicine will be the people you work with, and also the people you help. So go to the next slide. So I think we sort of mentioned this a little bit before as well. So look, I did I joined medical school in the last century. So how you get into medical school, very different from when we did it. I don't think I'd be able to give you very useful tips, but I'm sure your teachers and peers will. What I do is I work with a lot of doctors in their training, postgraduate training. So basically, once you leave medical school, and part of my role as a college tutor is to help people through that journey. So yeah, medical school, it's going to be 5, maybe 6 years. When you finish, the first 2 years of training is called the foundation training. The first year of that, you apply for, and hopefully you get a place near your med school, but it could be anywhere in the country. First year tends to be just generally medicine and surgery, and they're safe bets, and you're very well supported during that time. The second year might be in the same hospital, but you might actually have to move hospitals. And foundation 2 tends to be slightly more specialist. So emergency medicine or ED tends to be a must. So you'd probably do 4 months of that. You would do probably 4 months of GP, maybe 4 months of a specialty, maybe psychiatry, just, something, it could be anything out there. You do get to ask for a specialty you want. Hopefully it's something that you want to explore. But sometimes you end up just doing something a bit random, unfortunately. At the end of those 2 years, you are qualified as a foundation doctor. You are free if you want to leave the country or you want to go and spend another year. Like Dr. Hussain did, you could do a year out and explore lots of things, or you might want to run through with training. I took a year out and I went to Australia, and I think most people who took a year out will say it's a really positive experience, and I would definitely recommend it. In fact, more people will take a year out than go straight into the next step. So the next step involves applying for what you want to do next. So if you want to do general practice, as Dr. Hussain said, that would be 3 years of training. Again, the application process is national, so you could end up anywhere in the country, but hopefully you get somewhere near where you want to be. If you do a specialty like surgery, then you would start specializing either for a period where you do general surgery, or you could end up doing something which is super specialized, like say radiology, for example, in which case the training would be what we call run through. So that means once you enter it, you complete it, and the next step beyond that will be a consultant. What I do is I'm a physician, so our training is divided into 2 bits, as I can show you in this slide. So we do 3 years of general medical training. We call that internal medicine. So we would do jobs where we rotate through lots of specialties in medicine. At the end of those 2 years, sometimes 3 years, you will end up applying for a specialty, like a subspecialty in medicine. So that could be like, say, if you wanted to be a kidney doctor, you would be a nephrologist. If you wanted to be specializing in cancer, you might be an oncologist. And the training you have to apply for, again, you might be moved around the country. So unfortunately, that's one of the downsides. You might have to move quite a lot of times before you finish your training. From finishing medical school to being in a position where you could apply for a consultant job, it's going to be at least 10 years. The more specialized, the more demanding specialty you go into, the likelihood is that the longer it could take. It could take up to 15 years, to be honest with you. Most of the training programs are designed so that if they gave you what they call a training number, there will be a consultant job probably waiting for you in the country, but it might be somewhere hopefully close to where you live or you want to be, but it could be somewhere a bit further afield. And then you enter your consultant job. So I started my consultant job in about 10 years ago from now. Like Dr. Khan was saying, it's not, consultant job is not the same as a training post. In a training post, you end up spending a lot of time with your patients. You end up spending a lot of time with your head in the books, studying for exams. And you also have something called a portfolio, which is basically runs you through all the different things you have to do to move on to the next stage. Like a curriculum that you might have for GCSE, we have ones for different specialties. And you have to tick them off as you go, and the exams are sometimes little checkpoints that you have to go through. Once you become a consultant, it's very different. So you have a lot less patient contact. People are really surprised to know that in our job plan, I would probably have maybe 50% of my time is not at all in front of a patient. Some of the time I spend will be on the wards looking after patients. Some of the time will be in outpatients. But actually, a lot of my time is spent telling other doctors what to do. So rather than me sort of having face-to-face time with patients, it might be me training the juniors to make the right decisions, helping them sort of guide them through complications and what to do in different scenarios. So there's a lot less patient contact, a lot more responsibility. I sort of mentioned, would you take the blame for what your younger brother does? A lot of being a consultant is like that, because everyone that works for you, any mistake they make, it is actually your mistake, even though you might not have had anything to do with it. That's the burden you have to shoulder, and that's what you have to mitigate for. Litigation, I mentioned that because unfortunately the UK is becoming a little bit more like America, where people will be very quick to put in complaints, and that could be, over very minor things, or it could be for legitimately for serious reasons. So unfortunately, you have to have become a little bit of a lawyer as well in your side job. Um, you will end up specializing. There's no two ways about it. I went into elderly care because I quite like being a generalist. I like knowing a little bit about everything. I I I like the fact that you kind of almost look after a slightly disadvantaged population, and a population that's kind of overlooked a little bit. In my hospital, looking after older people means looking after patients who are over 75 with medical conditions, and I really enjoy that. But you will end up specializing. So even if you're an elderly care doctor, you might end up being a doctor that specializes only in stroke, or maybe just in maybe what we call movement disorders, or various things. So I specialize in front door things that's to do with the emergency department. Um, that's the clinical side. The non-clinical side, the bit that doesn't involve patients, most people will end up specializing in either management. That's to say that you get involved with running the hospital, teaching, which is kind of what I do a little bit of as well, or research if you have that kind of scientific mind, and you want to sort of, make new discoveries, then you will want to get involved with research. And that will tend to be pretty much one of those three things is something you will end up doing on the side. Um, so it's not all doom and gloom. As you become a consultant, you get a little bit back in stability. You don't have to do night shifts for most specialties. Some specialties you do, but most specialties you don't. And even if you do nights, it tends to be, again, more for advice. Obviously, if you're a surgeon, you're going to have to operate in the middle of the night, but that tends to be not as common. You get autonomy, and that's basically a word that means you have a little bit more say. You don't get people telling you what to do, although they might try, but you pretty much have a job that, as Dr. Khan said, you can't really get fired from. So you can pretty much get away with a lot of, stomping your feet down and trying to get things done in the hospital. And then comes a little bit of balance back into your life. You get to have a slightly more 9 to 5 job. You will bring some of it home with you, but you can be super organized and try and leave it at work. So you can spend time with your family. You might have a little bit more financial security. You might have a little bit more say where you work, and you get a little bit of balance back. And with that comes a little bit more of the well-being and the sort of, the kind of, the things that you really enjoy as well. I'm not saying you won't enjoy your training, but actually you get to appreciate it a little bit more because it feels like you've been through the hard bit. And being a consultant, I think that definitely is the light at the end of the tunnel, and I think you get a lot of benefit from that. And that's kind of, where we are now. And I think sort of all three of us are really, I think we all three of us agree that it's a really good career, a really good profession. And I think if you go into it for the right reasons, then it can be the best thing you can do. Yeah, and I think that'll end it back.